Hello and welcome everyone to tonight's webinar about summer disaster planning for primary care providers in the ACT and Southern New South Wales. This webinar is brought to you by the Capital Health Network, ACT Health and Doctors for the Environment Australia. First, I would like to acknowledge the traditional custodians of the land we are meeting on. I acknowledge and respect their enduring culture and the contribution they make to the life of this city and this region, and I pay my respects to their elders past, present and emerging. I also acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending tonight's event. Their land was and never has been ceded. I'd also like to acknowledge the recent events and how they may impact on the wellbeing of First Nations people across Australia. I am Dr. Leonie Harcourt, a GP advisor at the Capital Health Network. Also with me tonight is Kanal Mohiti, the events lead at Capital Health Network, Dr. Sally Singleton from ACT Health, and Drs. Kate Wylie and Jennifer Conway from Doctors for the Environment Australia. So onto housekeeping. All participants have been muted. Please address any questions in the Q&A section, not the chat box on your Zoom window. So the Q&A section, not the chat box. We'll have a question and answer session at the end of all the presentations, and the presentation itself will be uploaded to the Capital Health Network YouTube page, and you're welcome to share it with your networks. Regarding CPD, please fill in the post-event evaluation survey so that CHN can email you a certificate of attendance after the event. And please feel free to self-report 1.5 hours of educational activities to your CPD home. So before I start, I just want to highlight the Health Pathways website. If you're not aware of the website, it's a free and reliable source of up-to-date clinical and referral information for primary care providers that is localised to the current area. The login for Health Pathways for the ACT and Southern New South Wales region is together, the word, and it's all lowercase, and the password is FORHEALTH, FORHEALTH, all lowercase. So throughout tonight's presentation, we're going to see slides from the Health Pathways Disaster Planning and Heat-Related Illness pages. And the Health Pathways team was always keen to have feedback about the pathways, about how they can improve them and update them. So there's on the bottom of each page, there's a feedback tab that you can click on if you'd like to provide feedback about the page. So tonight, we're very lucky to have our 3 presenters. So thank you very much for agreeing to present. And our first presenter tonight is GP Dr. Kate Wylie. Kate is passionate about climate action to improve health. Kate is the Executive Director of DEA, Doctors for the Environment Australia, a not-for-profit group of doctors and medical students who understand that you need a healthy planet to have healthy people. DEA focuses on the human costs of climate change and biodiversity loss, and on the importance of health professionals in addressing the climate change health impacts. Kate is the immediate past chair of the RACGP's Climate and Environment Medicine Specific Interest Group, whose aim it is to elevate the need for climate action with GPs across Australia. In all her work, Kate applies a medical model to the climate crisis, and as such, offers a treatment plan for climate change. She seeks to activate her audience so they can help create the paradigm shift that we need to combat the climate crisis. Her motto is, "Our planet is worth saving, and so are we." So over to you, Kate. Thank you very much.
Thank you, Leonie. Thank you for that lovely introduction, and very happy to be here, and thanks for the opportunity to speak. I suppose tonight I'm kind of laying the beds. I'm sort of talking about the why that we have to be concerned around disaster planning in general practice. So really my talk's climate change, natural disasters and primary care. Just figure out how to move forward slides. And I'll also acknowledge country. So the nation we call Australia is stolen land. First Nations people have never ceded their sovereignty of their land, and respect is owed. I'm calling from Ghana land, otherwise known as Adelaide, and hello in Ghana is Namani. So Namani to you all, and thank you for taking the time to come along to a webinar this evening. I'm sure everyone here is a busy person. What I also want to acknowledge is the climate health emergency. Doctors for the Environment Australia, the AMA and multiple medical colleges recognise that climate change is a health emergency, citing the clear scientific evidence and the obvious health harms. Currently we are at about 1.1, 1.2 degrees global average of global warming, and we're going to spend the carbon budget for a 1.5 degree world probably by the end of next year, according to the Climate Council, and by the end of the decade, we'll spend the carbon budget for a 2-degree world. So, you know, the time for climate action is now. This isn't something that we can defer anymore. This is something that we need to be paying urgent attention to. My talk is divided into 4 sections. I'm going to do an overview of climate and natural disasters. Then we'll have a look at heat waves, then fires and smoke, and then mental health at the end. So just to make sure that we're all on the same page here, fundamentally with global warming and climate change, basically what we know is that burning fossil fuels releases greenhouse gases, which increases the greenhouse effect, which increases the temperature, causing more extreme heat and changing the climate. So when we burn coal and oil and gas, we release carbon dioxide, methane, nitrous oxide, and a whole slew of others. And these gases rise, become incorporated into the gaseous layer that surrounds our planet that acts to keep heat in. The thicker and denser this layer of gases, the more heat is reflected back onto the Earth. And this is basically caused global warming and climate change. We know that the planet is getting hotter. We're currently the hottest we've ever been in recorded history. This graph shows global surface air temperature anomaly for the months of September. And you can see this September, this massive uptick that we've had in 2023, going back compared to how it was back in 1940. And, you know, put another way, again, here's the Earth's average temperature starting from the 1850s and going up and up and up and up since the beginning of the Industrial Revolution, when we started burning coal and oil and gas. I think it's also really important to remember that when we're talking about an increase in temperature, we're talking about an increase in the average temperature, because 1.1, 1.2, you know, it doesn't sound like much. You know, if it's 25 or 26, I can still take my dog for a walk. Why does it matter? But of course, as soon as you plot temperature on a bell curve and realize that we're talking about an average temperature, I think we can all immediately see why it matters. So starting with using Australian numbers, and look back in the olden days, between 1960 and 1991, the average temperature in Australia was 21.8 degrees. And some days it was cold and sometimes it was hot, but the average temperature was 21.8 degrees. In 2019, the average temperature in Australia was 23.3 degrees. And what that means is that whole curve shifted to the right. And of course, there was still nice days. And of course, there was still some cold weather. But what there was more hot weather and more extremely hot weather. And that has massive impacts on the ground. I want to play just a little clip now by a hero of mine, Antonio Guterres, who's the UN Secretary General, when he talks about us being now in the era of global boiling. It only takes a minute. Oh, no, I don't. Wait a sec. Technical problem. Let's do that again.
Humanity is in the hot seat. Today, the World Meteorological Organization and the European Commission's Copernicus Climate Change Service are releasing official data that confirms that July 2023 is set to be the hottest month ever recorded in human history. The consequences are clear and they are tragic. Children swept away by monsoon rains, families running from the flames, workers collapsing in scorching heat. And for scientists, it is unequivocal. Humans are to blame. All this is entirely consistent with predictions and repeated warnings. The only surprise is the speed of the change. The era of global warming has ended, the era of global boiling has arrived. The air is unbreathable, the heat is unbearable, and the level of fossil fuel profits and climate inaction is unacceptable.
Absolutely well said by Mr. Guterres there. And, you know, I think what it really says is that we have no time anymore to kick this can down the road. We have to be acting around climate now. And, you know, this square is from the Climate Council. It's more than 5 years old, and they called it then, "How Will Climate Change Affect Australia?" I've changed it to how does climate change affect Australia? Because everything the scientists have predicted is happening to us now. We're seeing the more intense cyclones. We're seeing the big extreme rainfall events. We're seeing the hotter and drier conditions and the harsher bushfire weathers. We're seeing heat waves becoming longer and hotter, sea level rises, big thunderstorms, and droughts becoming more severe and more often. You know, when we come to the scientists, the Intergovernmental Panel of Climate Change, they tell us the same thing. They are telling us Australia's warmed by 1.4 degrees. So it's hotter in Australia, that our average temperature increase is hotter than the global average. We know that heat extremes have increased. There's less cold. This is going to get worse. We know the sea level is rising. We know there's less snow. We know that fire weather days are increasing and the fire season is becoming longer, and intensity, frequency and duration of fire events is worse. We're getting the big floods and the rain. We're getting the marine heat waves. We're getting the dust storms. And we also know that it's projected to be worse the hotter it gets. 1.5 versus 2 degrees matters. We really need to be going for a 1.5 degree future. And of course, you know, we're seeing it already on the ground this spring in Australia. Already we're having heat waves in spring. That's unheard of. That's an unusual thing. This is not situation normal. This is abnormal. We're seeing schools closed. We're seeing the awful fires. My heart goes out for the people of Tara and what's happened to them. They've lost their homes. They've lost their livelihood. And of course, we can't forget the massive floods that we had with Lismore and all across the eastern seacoast, you know, just a couple of years ago. And what that meant for disease, what that meant for health infrastructure, and of course for mental health. So, you know, I think that just shows that climate change is affecting our health now, and it's just going to get worse the hotter it gets. And for us as healthcare practitioners, we are seeing these things on the ground now, and we have to be prepared. So I've got sort of 3 sections I want to talk about: heat waves, fire and smoke, and mental health. And while I do this, I want to talk about a tale of 2 families, the Smiths and the Jones. And the reason why I'm doing this is because, you know, climate change has this great social justice factor. You know, certainly there's a lot of inequity in the impacts of climate change. Fundamentally, people who are doing it tough do it harder and are more affected by climate change. So yeah, I've got my 2 families, the Smiths and the Jones. They're similar in that there's 2 parents, 2 children, 16 and 12 years old. And I apologize, it's a very heteronormative family and a very Anglo family. But fundamentally, the Smiths, they're a privileged family. Both parents have good incomes. Dad's a surgeon, mum's a university professor. The children go to private schools. They live in a big stone house on a tree-lined street. They own their own home. They can afford to pay their bills, go to the doctor. They drive nice cars. They go on overseas holidays. Dad's got high cholesterol and high blood pressure. The youngest child has asthma, and their world looks like this. The Jones, though, they're not a privileged family. They're underemployed. Dad's a courier driver. He gets reimbursed for his work. Mum has a casual job at the local supermarket. The children go to the local public school. They live in a poorly insulated house. There's not many trees. They rent. They can't afford to pay their bills. They can't afford a gap for the GP. They've got 1 car that's 10 years old. If they go on a holiday, they're going to go camping. Dad has hypertension, high cholesterol. The youngest child has asthma, and their world looks like this. So just remember these 2 worlds as we go through these scenarios and kind of think about how that might impact on your patient populations as well. So let's start with heat. So heat waves, 3 days or more of high maximum or minimum temperature, are unusual for that location, and they are Australia's most deadly natural disaster. Always have been, even, you know, before climate, but obviously as things get hotter, we're going to see more heat waves. The exact mortality numbers are difficult to obtain, but one study shows that between 2006 and 2017, more than 36,000 Australians lost their lives due to extreme heat. It's a big number. Heat waves certainly mean increased health service demand in Australia, and heat is often called a silent killer with the deaths attributed to another cause. So we know we have an uptick of cardiovascular events during heat waves, acute renal failure and mental illness. There's an increased risk of suicidality during heat waves. These 2 meta-analyses kind of bring this out. Heat exposure and cardiovascular health outcomes, a systematic review shows increased cardiovascular mortality with each 1 degree temperature rise. The strongest evidence there is for heart attack and for stroke and coronary heart disease, but also lots of evidence around arrhythmias and MIs. The risk is higher for women, people over 65, and those in tropical climates and a lower and middle income. And the one on the right talking about mental health, same author, by the way, this person, I really want to meet them. Again, increased mental health mortality with each 1 degree temperature rise, especially for substance use disorder and organic mental health disorders. And again, vulnerable patients are those over 65 and people living in tropical and subtropical climate zones. So yeah, women, older women in tropical zones are at high risk during heat waves. We know the heat waves are getting worse with climate change. So heat waves have undergone major increases in the 2000s in comparison with previous decades. And we know that they're going to projected to increase as the planet gets hotter. This study has kind of estimated heat wave severity in 3 types of climates that we see in Australia. So an arid climate, a tropical climate, and a subtropical climate. And they looked at heat wave number, heat wave duration, and heat wave peak temperature. And what they basically found, and it's pretty logical when you think about it, is that the hotter it gets, the worse the heat waves are, the longer they are, the hotter they are. And so they show that heat waves may be 85% more frequent if global warming increases from 1.5 to 2 degrees, might last up to a month if global warming increases to 3 degrees. And let's remember, right, currently we're at 1.1, 1.2. The global projections are, with our current policy, that we're looking at about a 2.5 degree world by the end of this century. That's if governments do what they say they're going to do. And let's also remember that Australia is hotter than the global average. So, you know, we're looking at 3 degree future. And we need to get ready. We need to be prepared to treat it in our world. This projection data comes from the insurance industry. And so, of course, they're very robust in their methodology. And I won't read it all, but I just want to, it's projected mean average days per year above 35 degrees per capital city. And I just want you to have a look at Darwin. So currently Darwin, you know, it's always hot in Darwin, right? It's always hot. 46.83 days above 35 currently. They're looking at, by the end of this decade, more than 100 days per year above 35. And this doesn't count the days that are 34. And then by 2050, 176 days per year above 35. That means Darwin's unlivable. You know, what's going to happen to the people there? Where do they go? What's going to happen to their health? How, you know, this is a massive, massive problem. Of course, some groups are more vulnerable to heat than others. It's, you know, the elderly, obviously, you know, as we get older, we get less aware that we're getting too hot. Elderly people more likely to have comorbidities, might be on medications that dry them out, you know, like the diuretics or anticholinergics, tend to be socially isolated, or maybe then, of course, the very young, because, you know, little people are short and round, they've got a high surface area to volume ratio, means they dehydrate more quickly. Pregnant women with the hyperdynamic state that pregnancy is, people with mental health conditions, people with underlying medical conditions, and pretty much any of them. People who work outside, so tradies, very much at risk during heat waves. People in poverty, often renting, often unable to afford air conditioning. People who are homeless, of course, and those that live in cities. So there's this concept of the urban heat island effect, where basically, because cities are made of cement and asphalt, in that when it's hot during the daytime, those surfaces absorb all that heat, and then that heat is released during the night, but it keeps the surrounding air temperature really high. I love this map of Adelaide. It's a heat map of Adelaide, and you can basically see how here in North Adelaide, which is a quite well-to-do suburb with lots of tree-lined streets, how much better off you're going to be if you live around here versus if you live up here in Croydon, which is a pretty much a struggling area and lots of industry up there. Obviously, you want to be by the river. That's the coolest place to be. So what do we do about this in general practice? And I know that we'll get more practical advice from Jenny and Sally after me. But what we can do in general practice is fundamentally be forewarned is forearmed. We can identify the high-risk patients in our patient cohort and educate them about heat wave risk. You know, tell them to be careful. Tell them they're at risk of heat stroke, heat exhaustion. Tell them they're at risk of heart attack. We can incorporate heat wave safety into our care plans, especially for our vulnerable patients. And, you know, certainly I do that with my patient cohort. We can consider check-in systems on hot days, and we can advocate for climate action to stop making the problem worse. All right, that's heat. Of course, when there's heat, what else are we at risk of? We're at risk of fire. And when there's fire, what are we at risk of? Smoke. And, you know, I think, you know, everybody's scared of fires. I know I am. I'm quite frightened of fire. And of course, burns are horrific. And, you know, no one wants a 3rd-degree burn or a 2nd-degree burn or any burn for that matter. But really, when it comes to bushfires, it's the smoke that has the greater disease burden. Like in the Black Summer fires, 33 people died by fire, which is awful. But, you know, more than 400 died from smoke inhalation. So it's the smoke that's the biggest disaster for us. So, yeah, these two studies bear this out, health impacts of bushfire smoke exposure in Australia. Basically, we know that the particulate matter 2.5 and particulate matter 10 gets into our respiratory tract, and we see more ambulance call-outs, we see more hospital attendance, and we see exacerbations of COPD and asthma, and mixed effects with cardiovascular, increased MIs in the first 48 hours after a fire. The study on the right, unprecedented smoke-related illness associated with the Black Summer fires. In their 3.5-month period, they saw 417 excess deaths from smoke, more than 1,100 hospitalisations from cardiovascular problems, more than 2,000 for respiratory problems, and more than 1,300 presentations to ED with asthma. There's this concept called the air quality index, and you know, certainly I think we should all be aware of it, and I think we should make sure our patients are aware of it as well. There's an app called the Air Visual app, which I have on my phone, and it basically tells the air quality where you are and all across the planet. So air quality 0 to 50 is good. It's obvious the higher the number, the worse it is. Anything above 300, everyone should avoid all outdoor exertion. But even in the 50s to 100s, if you've got a respiratory tract problem, like if you've got asthma or some underlying respiratory condition, you're at risk. You have health risks from the air quality. You know, and in fires, we get these big numbers. During you know, Black Summer, Sydney was getting numbers in the 500s quite regularly. I know you had some really high numbers around Canberra. So back to our family, the Smiths and the Jones. The Smiths, they live in a well-insulated home, so their house isn't too smoky. They've got new P2 masks that they can wear when they go out to the shop. But their son gets a bit short of breath, but has an asthma action plan, has Ventolin, has a spacer, has his preventer, all of that. He has his first day for his asthma, he's fine. The Jones, different scenario. The Jones house is smoky because it's not well insulated. They've got some old surgical masks kicking about, but they're pretty useless. The son has an asthma attack. They haven't been able to renew the asthma medication script, so no puffer. Mum tries an old puffer she's got left, you know, in the bottom of her bag. It's pretty useless. They haven't got a spacer. Son becomes increasingly short of breath and wheezy, and they call an ambulance to get him to the emergency department, something they probably can't afford but need to do. So what can we do about this in general practice? Again, forewarned is forearmed. We can identify our high-risk patients and educate them about smoke inhalation risk. So our asthma patients, our COPD, our cardiac patients, and our pregnant women, you know, we can warn them smoke inhalations associated with low birth weight. We can incorporate fire safety and protection from smoke inhalation into our care plans, especially for our vulnerable patients. We can get everybody to check their air quality index and be aware of it. Again, consider checking systems on fire danger days. You know, tell them about these 10 things that you can do. And we can advocate for climate action to stop making the problem worse. And lastly, I want to talk about mental illness because, you know, that might not be the acute presentation that we're having with our natural disaster. But you think about these people, you know, they've been in a fire, they've been in a flood, they've been in any of these natural disasters. Of course, it affects us psychologically. How can we help but be psychologically affected? Doctors for the Environment has a report on this, how climate change affects mental health in Australia. I've just got a few little things about natural disasters out of this report. It's much more extensive than that. You know, we know that the psychological distress from natural disasters exists. It might be mild and transient, but it also might be severe and long-term. We know there's increased rates of domestic violence and alcohol and substance abuse around natural disasters. And we also know that there's increased rates of PTSD, anxiety, and depression afterwards. Again, increased suicide rates with natural disasters. And of course, you know, with climate, what we see is these compounding events. You know, there's a heat wave, and then there's a fire. Then there's, you know, some other disaster happens to people. And we're getting to this point where people are getting these sort of ongoing assaults to their psyche that is, you know, hard to recover from. Eco-anxiety and climate grief, this sort of ongoing awareness of what's happening to our planet, and are increasingly recognised and are considered a rational response to a real threat. And you can look up that on the RNCP's website. This study, Climate Anxiety in Children and Young People and Their Beliefs About Government Responses, shows us that young people around the world are really worried about their planet and feeling it. 10,000 children, of which 1,000 were in Australia. So respondents across all countries were worried about climate change. More than half are sad, anxious, angry, powerless, helpless, and guilty. Awful words. A lot feel that climate change negatively affects their daily life. 75% say they think the future is frightening. 83% think that we failed to take care of the planet, which is true. They feel betrayed by their governments. And the climate anxiety and distress is correlated with perceived inadequate government response. So, you know, for our young people out there, climate anxiety is a thing, and certainly something that we should be screening for, talking about with our patients. So this time with my families, I've given them the same thing. You know, the older child becomes increasingly withdrawn, spending time isolated in their room, looking up climate change on their phone. They're overwhelmed by feelings of sadness and anger. They stop socialising, start self-harming. They go to their GP. For the Smith's child, the GP diagnoses depression, doesn't screen for concerns about climate, refers to private psychology and seen about a month later. For the Jones, same thing, but referred to the public waiting list, and, you know, that's a 6-month waiting list. Certainly that's what it's like in South Australia. And what do we do about that in general practice? You know, certainly we need to recognise that mental health will be impacted by natural disasters and climate change. As I said, we need to screen for it in our patients. And, you know, it's pretty easy to do. You just ask, you know, are you worried about the planet? You know, I routinely do this with everybody that walks in with mental health stuff into my rooms. We can incorporate this knowledge into our mental health care plans so that the psychologists are aware, and we can advocate for climate action to stop making the problem worse. I have put a QR code to a resource that I commonly refer to for this from the Australian Psychological Society, Activate 8 Psychological Strategies to Tackle Climate Change. I find this very helpful. The second A is Act for Your Climate, and certainly that helps me with my own climate anxiety. All right, so that's me. I'm finishing us off on this very nice, soothing slide, because I appreciate that what I've just said is pretty full on and can be a bit hard to hear. But yeah, I'll stop sharing now and hand over to Leonie.
Thank you very much, Kate, for such a clear, impressive message. Yeah, it's devastating when you see the numbers so clearly presented. So I'll just move on now to our second speaker. So our second speaker is Dr. Jennifer Conway. Dr. Conway has worked in rural general practice for over 30 years and is well aware of the need to plan for disasters. She's based in the Upper Yarra Valley in Victoria and has lived bushfire experience. Jenny works with the Royal Flying Doctor Service, providing GP services to communities along the Murray that were particularly affected by the floods last year, and as well as consulting in Tasmania at the only clinic on the Tasman Peninsula, caring for communities that were greatly impacted by the major bushfires in 2013. She is currently completing a postgrad qualification in climate change and health through the University of Melbourne School of Population and Global Health. Jenny is a member of the DEA Victorian State Committee and is part of their biodiversity special interest group. So over to you, Jenny. Thank you very much.
Okay, well, good evening, everyone, and welcome. I'll just get my screen up. So hopefully you can all see that now. So thanks, Leonie, for that intro, and thanks, Kate, for that very sobering presentation. It's pretty stark hearing what we're doing to our planet and what impacts it's having on ourselves and our patients and our communities. So what I'm going to be doing this evening is basically, if I can get my thing to work. Sorry. I'll let my slide progress. There we go. So I'll just quickly give you a little bit more background about myself and why I have an interest in the subject. Then I'm hopefully going to give you all some practical tips on how you can prepare initially yourselves and your family. And because a bit like when you're flying on a plane and there's an emergency, you have to put your own oxygen on first before you can help those around you. Then I'll be moving on to the resources and why it's important to prepare your practice. And then also what we can do to encourage our patients to be prepared for all these terrible events that are going to be happening in increasing frequency. Kate's also touched a little bit about how we can play a role in helping our communities deal and recover with disasters, but I'll expand a little bit more on that. And also at the end, there's going to be a list of resources that you'll be able to access, including a bit about the health pathways that your PHN has developed and has some really fantastic resources there that are customised for your area. Okay, so I also would like to acknowledge the First Nations traditional custodians of the lands that I'm coming to you from, which is in the Yarra Valley in Warburton, and it's the home of the Wurundjeri people. Our little town is one of the most fire prone on the planet. We're no strangers to bushfires, and we also get riverine floods. We're a little town, only 2,500 people, but it's being only 90 k's east of Melbourne. It's a tourist hotspot, so we get inundated on long weekends like we've just had with the Melbourne Cup long weekend, and during summer with loads of people coming up to enjoy the pristine nature that's on our doorstep. And a lot of those people have no idea about bushfires, and a lot of the people that moved out here during COVID also don't really have any lived experience of bushfires. So it's something that those of us that work in the healthcare sector and the emergency services are very concerned about. I work with the Flying Doctors, as Leonie said, up along the Murray in a town called Robinvale, which is a very important meeting place for numerous peoples, Indigenous peoples as listed there. Robinvale was very badly affected by riverine flooding about a year ago, and many businesses and buildings in the town were affected, including the practice. It was very badly flooded out and had to relocate to the Community Health Centre, which is where it's operating out of now. And there's many families that were very adversely impacted by that. And so I've been working there for this year, and I'm finding there as many mental health issues and people struggling with the financial fallout from having their farms and their businesses adversely affected. Interestingly too, they had their first cases of Japanese encephalitis confirmed, with a lot of the zoonoses increased with mosquito-borne illnesses increasing because there was so much water lying around, and Kate did touch on that briefly. So that's something that with increased flooding events, we're all going to have to educate ourselves about, even if it's not something that we've come across in clinical practice to date. So top tip number one, it's important to know your area. And Kate's already mentioned the Climate Council. They have some fantastic resources, and I'd recommend you have a look at their website. And one I particularly like is this particular page where you can go in and it'll tell you what your risks are. So you can put in your postcode or hover over a map and say, I've put in Warburton, and it tells you all the horrible things that potentially could happen because of climate change. And lucky us, we have 100% of properties are at risk. So that means my entire community where I live potentially is going to be very adversely impacted by mainly fires, because we're surrounded by beautiful forests, but also the people that are lucky enough to live by the banks of the Yarra, which flows through our town. They can be flooded out too. So you can't win really. So knowing your area, knowing what the risks are, and then preparing yourself is a way to actually feel like you have some agency with what is this climate crisis that we're currently in. One of the things I've done to, I guess, give myself a bit more of a sense of purpose in helping my community is I've joined our local emergency planning group, and most small communities will have something similar. And it's a really good way to bring your health expertise to a group that often are working with your local government, and also creating connections within your community, whether it's with the local sporting clubs. We're currently going through a process mapping out where our emergency evacuation hubs are going to be, what services are going to be available, what the local council are going to be able to provide, and just having it's like a mapping out exercise. So when the next catastrophe hits, we're not caught flat-footed. We're actually going to have a plan that we can implement. And my joining that group has been to, I guess, really promote the health component of that, and amplifying the message about how people can prepare themselves from a medical perspective if they know that they've got underlying vulnerabilities that might put them more at risk of adverse health impacts. So first off, preparing your family. Even though I'm Victorian based, I have had a bit of a look at what your ACT government has available on their websites. And so these survival plans and links that I've put up are specifically from the ACT Emergency Services Agency, and they're actually excellent resources. Many of you might already be well aware of these, but if not, I'd really recommend that you have a look. So be emergency ready. They have a resource about making a survival plan and going on, packing the essentials. And so, you know, in the heat, and we've been through this ourselves when Black Saturday back last decade occurred, trying to think on your feet, thinking if we're going to evacuate, when do we evacuate, what do we need to take? It's much better to have all that pre-packed. And so if you make the call to leave, you've got things in tubs that's already packed in the car. And this is just a little prompt to help you make sure that you've got all your essential things. So I'd recommend that you have a look at that. Now, preparing your practice. For those of you that are members of the RACGP, you may well already be aware of this planning tool that the college developed a number of years ago. And it basically steps you through what you can do to not 100% proof your practice, but to at least have all your backup systems in place, knowing, you know, whether you've got a generator when the power goes off, or having, you know, old handwritten prescription books because the computers aren't going to work, and if you're going to try and keep your doors open, what you've got in your emergency treatment room to deal with any burns or things that might come in, all that sort of stuff. So I know here in Victoria, our Department of Health is actually funded for general practices to be able to access this for free without having to have the annual subscription. And I'm not aware what the situation in the ACT, perhaps we'll hear about that with our next speaker, but it's a very, very comprehensive resource that I would recommend that your practices implement, because it really doesn't leave anything unturned, stone unturned rather. And I understand that as part of accreditation now too, it's an expectation that you have some sort of emergency plan. So this is an excellent template for that. So this is just another, if you go on to the college website and have a look through the emergency response planning tool, this actually is one of the pages that you can go to, and you can click on those links and it gives you a bit of an overview of what's on offer. And on the website as well, this is again the RACGP website, is this fantastic manual which you can actually download, which basically goes through in very comprehensive style, giving you ideas of what to do. So if you don't want to use the tool, you can actually use this document as your guide, and also then be able to customise your own emergency plan for the practice. And so this is just an example on that from that manual, things to look out for, that what we can do when we're managing an emergency, the impacts that the emergencies will have on the practice, you know, whether you actually, like they did in Robinvale, have the premises flooded out. And so, you know, the computers weren't working, the phones weren't working. In that situation, the clinic actually, they relocated down to the football oval, and the doctors were working out of there until they got themselves organised to move up to the community health centre. And, you know, the disruption that can cause, the stress to the doctors, to the practice nurses, to the receptionist, to the practice manager, you know, you can only imagine how difficult that would be. And one of the things in this tool is that they say that if you can, it's really important to have a lot of your information stored on the cloud securely, because that way then, even if, you know, all of your IT stuff gets wrecked, so long as you have a functioning piece of kit, you'll be able to log in and access that information. And obviously there's, you know, it has to be adequately secured and passworded and so forth. But again, you know, if you go through that manual and set everything up securely, there are ways around this so you're not going to get caught short. And these are just some other resources that the college have for GPs, that again, if you spend a half an hour or so going through the emergency management pages on the college website, you'll find some really useful resources there. Now, for those of you that are members of ACRM rather than the RACGP, ACRM also have some really useful resources as well on their website, and they also refer to the emergency management tool. So for those of you that don't pay up membership to the RACGP, all is not lost. You can also look at ACRM. And now we get to the community health pathways, which I really am quite jealous that your PHN has got a customised version of this for disaster planning and management. It is a really fabulous resource. As Leonie said at the outset, if you log in using the password, you'll be able to access all of this information. And again, it really has all that information in one central place, which not only talks about what you can do in your own practice, but actually preparing your practice, preparing your patients, and what other specific localised disaster support services are available in your area, which actually makes it a very user-friendly document rather than the sort of more generalised documents that I was speaking to earlier. Now, moving on to preparing your patients. So as Kate did mention, identifying your vulnerable patients is really important. And in general practice, because we provide cradle to grave care, you've got the whole range and gamut of patients who, because we know our patients well, we should be able to hopefully have a good enough relationship that we can actually raise it with them during the course of a consultation. I'm a great believer in opportunistic discussion. And if people are coming in for their review of their chronic disease management plan, or it might be an antenatal visit or a postnatal checkup or whatever happens to be, it's a perfect opportunity to actually raise this and start the conversation about, you know, and often it's good if, well, it's not good if there's disasters happening elsewhere. But for example, you know, I've had conversations this week with patients about, isn't it terrible what's happening up in the northern states, you know, with these fires so early in the season? Oh, what are you going to do about your, you know, what's your bushfire plan, et cetera, et cetera. So you can use that as a lead in. Or anytime there's something on the news. I mean, it's one thing to get, you know, sad and depressed about what's going on and knowing that, you know, who knows what this summer is going to bring to our communities, but actually raising that as a topic of discussion with patients and then giving them some tips and tools to use to better prepare themselves so they're not then left panicking when the catastrophe does hit. One of the things that's a very simple thing is to make sure that they've got enough of their medication, that they've got copies of their scripts and they've got a copy of their care plan and health summary. So when they do evacuate, if they do evacuate, that they have all that information not everyone has a My Health record, and even if they do evacuate and then they need to see a doctor, say when they're staying with relatives, and they go and they can't remember what their medications are, etc., and then they try and ring the clinic. Well, your clinic may be out of action, and so they can't get that information. And the pharmacy might be shut because it's been burnt down or flooded out, so they won't be able to access that information. So making sure that the vulnerable people actually have all those resources with them and have it in their emergency bag that they're going to take with them when they leave is very, very useful and practical information. In our local government area, we actually have a vulnerable person register, and in the event of an emergency, there will be specific council staff who will be working through those registers, reaching out to make sure that those people have actually got someone checking on them, or if they, don't have transport, that they're buddied up with someone who can actually help them evacuate the area in the event of an approaching wildfire. I'm not sure whether, your councils actually have similar sorts of schemes, but that's something, a very worthwhile program that our Yarra Ranges Council has in place. And that was following the Black Saturday fires. Okay, so this is a screenshot from the health pathways about what you'll see when you go in there looking at preparing a patient for a disaster. As you can see, it basically steps through everything in a very logical fashion. And I would really encourage you all to log in there and have a look, because I think particularly in those consultations where you might be doing a mental health plan review, you might be doing a chronic disease management review, it actually will slot in very, very easily to the conversation, and that's just that added extra peace of mind for the patients. The other thing that I've found really useful over the years is being proactive in what you display in your waiting room or on your clinic website or social medias. So, for example, in our town, the CFA, or equivalent, I think it's RFS you call it in the ACT, as in New South Wales, we had a bushfire community meeting last week that was extremely well attended, all with a view to trying to get people in that mindset about getting themselves bushfire ready. And it's not just about preparing their properties, but also preparing themselves mentally, knowing what their limitations are if they, feel that they really aren't going to cope mentally or physically, that they need to get the hell out if there's going to be a catastrophic or a severe fire day declared. And we just find that often there'll be, useful links. There'll be, I'm a big fan, we have here the Vic Emergency app in Victoria, which I encourage all my patients to have on their phone. It basically is a government-run app, which again came after Black Saturday, which will actually send out, you can localise your area that you want to get alerts for, whether it's a fire, whether it's an emergency, like a thunderstorm. We had a big storm come through here this evening, and there was a thunderstorm asthma alert that was set out in the early afternoon, warning people in our area that the risk of a thunderstorm asthma event was very high. So, things like that, being prepared is you're halfway there with dealing with things and not getting super stressed. These are some resources that the RACGP have put together that you can download and print as posters for your waiting room. So sort of echoing what Kate was saying, that, it's a way of starting a conversation. If you have these sorts of posters up in your waiting room or in your consulting room, it often will prompt the conversation, and the patients may actually say, oh, what's this about, extreme heat? How's that going to impact me? And then you can actually have that conversation with your patients. So whatever tools you can use to actually open the door to having a conversation about, okay, this is happening, climate change is real. Even if you've got patients who aren't necessarily great believers in climate change, older people, some of whom think it's a load of poppycock. I've had some interesting conversations with some of my older patients. You can say, well, if there's bushfires and there's going to be a lot of smoke, we all know your emphysema is not that great. What are we going to do about that? What do you think you can do? And even if they don't buy into the climate change side of things, if you can talk to them about the impact of the smoke or poor air quality on their breathing, then that's a way of also preparing them. The other thing I found with my patients is a lot of them will have pets, and in the heat of an emergency, they don't necessarily think about what they're going to do with their animals. And I know during the Black Saturday fires, when pretty well our whole community, other than the emergency services and healthcare workers, evacuated, down about a 50k drive away was the main emergency hub at a football oval. And it was like Noah's Ark. You know, people took their ponies, they took their alpacas. It wasn't just cats and dogs. It was, you know, pet lizards. It was everything. And so sometimes I will get my way into the conversation with some of the perhaps more recalcitrant patients about, what are you going to do about your house cow? What are you going to do about your, you know, chooks? That sort of thing. Now, obviously, I live in a rural area, so they're the sorts of conversations I'll be having, not necessarily people that live in more urban centres, but just prompting that. People sometimes will be more concerned about what would happen with their pets than they are about themselves. So again, it's a way of starting the conversation with your patients about what they're going to do when there is some sort of emergency happening. Now, this next resource is put together by the Red Cross, and it is one of the most comprehensive planning and preparation emergency tools I've actually come across, and it covers absolutely everything. So there is an app you can download. If people don't want to do that, the website also is very good. And I've had the conversation with some of my older folk to say, well, you know, if you're not very computer literate, this would be a great thing to do over a cup of tea with your son or daughter or your grandkids or whatever. It will prompt them into really thinking deeply about what they need to do, where they're going to go, have it all mapped out, have all their emergency contacts there. They can, if they don't have it on the app, they can print it off and have it with all their documentation. And it's, you know, in the heat of the moment, it can be a wonderful resource to prompt, oh, that's right, I need to get this, or I need to do that, or I need to tell so-and-so I'm leaving now and I'm going to wherever they're going to. So again, it's all about keeping people safe and getting them out of harm's way and giving them some degree of agency so they don't feel like that they're totally bewildered and don't have any control over what's going on. It's not going to work 100% of the time, but like anything, you know, you're better off having a red hot go and having some hope of being able to get out and keep yourself safe, rather than just being all a dither when it comes on all of a sudden. And if you haven't done any planning, then it's very hard to actually achieve anything meaningful if you're having a major panic attack, or you can't breathe, or you're having chest pain, or whatever it is it happens to be, because you're a vulnerable patient. So far I haven't actually been bombarding you with academic papers, but I will actually direct you to one that I have found to be invaluable. It was initiated by Dr. Penelope Burns, who has been a leading light with the College of GPs when it comes to disaster planning and management. And she's actually just completed her PhD in this field, looking at how GPs have been very much an underutilised resource in emergencies, that with the top-down command and control model that a lot of emergency services have, you know, there'll be amazing mobilisation of, you know, the tertiary hospitals and the ambulance services and the fire services and so forth. But the GPs that are on the ground in these communities often sort of fumbling about trying to do their best for their communities, but actually aren't integrated into the process. And so this paper actually, was a qualitative paper looking at speaking with GPs that have gone through disaster, you know, whether it's in New Zealand with the Christchurch earthquake, or, you know, the doctors that were working in communities very badly impacted by the Black Summer fires. So it's really a useful paper to have a look at, because, you know, it comes through time and time again how important GPs are. We're on the ground, we know our communities, you know, we know our patients very well. What impacts our communities impacts us as well. So we're in the thick of it with our patients and with our families, and how important our role is on the ground, even if we're just a shoulder for people to cry on. Even if we can't, you know, do a great deal, that just being there and supporting the community can have such a great impact on the initial resilience, but also then in the aftermath. Which, moving on now to what happens during the days and after the event. And I won't bore you by going through all of this, but basically we're looking at, can you keep your general practice doors open? Now, it might be that you are at your clinic, or it might be that you have to relocate, and then what can you actually offer? And so having some basic equipment with you, having some basic supplies, liaising with the local ambulance service, which is something I'm working on for our community here, and making sure that you've got access to extra support. So knowing if there's any other nurses that may not around in your community that may not be able to get down to their usual place of work. I know where we are, we have lots of nurses that live in the area but actually work at some of the major hospitals, 45 minutes, hours away. Well, in the event of the highway being cut, they won't be able to get to work, but they'll certainly be able to come and help out us looking after our community until we can actually get people out. One of the things we found with the Black Saturday was that the smoke was that thick that the helicopters couldn't come in. And so even though there were patients that were needing to be airlifted because of the burns, the choppers couldn't land and the highway was cut. So the cars, the ambulance vehicles couldn't get through either. So it was a matter of doing our best until such time that we could actually transfer patients, which thankfully we were able to do without losing anyone. There's the people that are in the disaster zone, then there's also practices that might be on the edge of the disaster zone. And one of the things that Penelope Burns talks about is considering whether in the event of a disaster, whether you'd be perhaps willing to go and assist. So you may not be directly impacted, but with your medical skills, if your practice can spare you, some areas have actually got a register. I know up in the Blue Mountains, they've actually, the PHN up there have got a register of GPs that have put in an expression of interest that in the event of another disaster happening, that they would be willing to be contacted to come and assist. So, that could be something that your PHN could consider. I know that's something that our East Melbourne PHN is looking at, given the great likelihood that there's going to be further major bushfires in the if not this summer, then next summer or whenever. But they're coming and they're going to happen. So we need to be prepared, not only on a micro level in our own practices, but also often, also on a broader scale. And so then also, if we can't work at our practice, where else can we go? Well, what's going to happen with the nursing homes? Are you going to go to an evacuation centre? Will you set up a tent clinic? Will you be a member of a local response group? Like, I said, I'm part of our local emergency planning group. And you might also just happen to be in the wrong place at the wrong time, or the wrong place in the right time, depending on if you're the patient or not. So, you can lend a hand, even though it's an impromptu thing. So again, it's about that self-reflection about what you think your capacity is. I have colleagues where they have young families, and so they've already decided that in the event of a predicted terrible weather event or severe extreme catastrophic fire day, that they will just leave, and that's fine too. I mean, you don't have to be obliged. There's nowhere do we sign up saying that we're going to put ourselves in harm's way. If the best thing for your family is to leave because you care for an elderly parent, you've got young children, you've got a child with special needs, you might have your own health issues, and you don't think you're able to stay, that's absolutely fine as well. But it might be then when the major disaster is past, and then it's picking up the pieces and supporting your community afterwards. That's an equally very important role to play as well. So this busy slide is from Penelope Burns's paper, and it basically shows the, I guess, the spectrum of things that can happen. So you've got, people have got their usual issues, and then that could be exacerbated through the disaster, whether it's, they've got not so bad anxiety that's been pretty well controlled by seeing their regular therapist and or some medication, whatever their management plan is, but it spirals out of control. And then you're probably going to be the first person, or your practice will be where they reach out for. And then you've got, acute exacerbations of chronic conditions. Kate already spoke to this a bit, the cardiovascular conditions, the respiratory conditions, people with CCF, people with renal disease, in heat events, all these sorts of things. And so, if you've had that discussion with your patients prior to these events happening, and they've got a game plan about what they need to do and how they can care for themselves and what, where they need to go to stay safe, hopefully we can minimise the terrible impacts that these sorts of disasters can have on our patients. I'll just briefly flag this. I'm not going to go into any great detail. Penelope Burns speaks to this a bit in her paper, and it's some courses and resources that we as GPs can familiarise ourselves with. It's come out of the US and it's been found to actually be very helpful, and was apparently implemented widely up around the Blue Mountains after the fires went through there. And I guess, as Kate flagged already, people who have pre-existing mental health problems may well deteriorate. People who've never had a mental health issue may well present for the first time. And people who've been very stable for a long time might suddenly spiral. So I guess having some mental health first aid, and whether it's you implementing that or your staff, or you looking into encouraging, your local sporting clubs or schools to maybe fund or get a grant from the local government or wherever to train up people in mental health first aid, means that there's going to be the opportunity to share the load within the community. And the more intensive program is actually called the SPR, Skills for Psychological Recovery. And this, again, has been put together by these people from the States. And it's an online course that you can do. And it's all about trying to help patients in the aftermath and help them with resilience building and better coping strategies, so they don't develop the, seeking solace in the bottle and developing drug and alcohol issues, or young people becoming progressively depressed and withdrawn and not feeling that they can talk to anyone about it, and then self-harming and potentially attempting suicide. So I guess it's looking at our patients holistically, obviously caring for their physical issues, being well aware of their psychological problems. And, when you look at someone holistically, you also have to look at their spiritual side as well. And so, it's important actually for people who have gone through any sort of disaster and are going through grief and loss, to hopefully, as GPs, you'll feel comfortable in raising that, because some people can get a lot of solace from that, even if you don't particularly believe in it, but it's something that you should consider. So this slide is just taken from the college website. They made some recommendations to the Department of Home Affairs about how GPs should be better included in emergency management planning. And they came out advocating pretty strongly that there needs to be recognition of GPs as being an essential service, and that we should be able to access emergency provisions and resources, because as it stands, and I've had this conversation with the health department, that, given that our community, for example, doesn't have a hospital, and in the event that we're cut off, which is highly likely because it happens every time there's a bushfire, the highway's closed, so there's no way in or out, and we're having to deal with burns and other injuries and whatnot, who supplies the resources? So the local clinic in town, there's one clinic with 2 doctors, they haven't got capacity to have a fully fledged emergency kit with heaps and heaps of burns dressings and splints and plasters and, you name it. We don't have an emergency department. The AMBOs don't supply it, so who does? So at the moment, I'm in the process of putting together a grant application to get some funding so our emergency planning group can put together some tubs of supplies that we will store, and we can then, you know, bring out in the event when we have to activate our evacuation hub. And, you know, so if there were to be a change of heart by the government, whether it's state or federal level, then there'd be special Medicare item numbers for us to be able to jump in and provide this care, and also they would provision us with supplies. So, but you know, that's a watch this space. So I'm not quite sure how far down the process this is, but if you don't ask, you don't receive. So takeaways. Main thing is self-care. So know what your limitations are. Have an honest appraisal of what you think your capacities are. And if your main priority is to keep your family safe and that you need to get out, that's absolutely fine, and just do it. If you're staying, then having disaster management planning about how you can keep your practice running even if it's not on site, and how you can best prepare your patients is really important, because as Kate said, these events are only going to get more and more frequent. So, you know, we spend a lot of time up here talking about the heat, and then the heat leads to drying off of the forest, and then the forest will then burn more. So we're going to have increased bushfires and everything that goes with that. And so, as I said there, proper planning prevents poor performance. Here's some of the resources. So because this is being recorded, you'll be able to access all of them. And finally, I couldn't help myself. King Charles III came up with this fantastic quote where he said, "There's nothing like a jolly good disaster to get people to start doing something." So we're going to be seeing lots of jolly good disasters. So it's time for us as GPs to do something for ourselves and our practices and our patients. And thanks very much, and best of luck with your planning.
Thank you very much, Jennifer. I didn't realise I'd be laughing at King Charles this evening. So such great resources, and a nice path out of disaster or emergency paralysis. So that's great. Thank you very much. So our last speaker tonight is Dr. Sally Singleton from ACT Health. Sally is a public health physician and RACGP and ACRM Fellow, and she's currently the Deputy Chief Health Officer at Population Health Division within ACT Health. Sally is presenting tonight in place of Dr. Toby Keene, Senior Director of Public Health Response and Capability within the Population Health Division at ACT Health as well. So over to you, Sally. Thank you very much.
Helps if I unmute. Thanks, Leonie, and confirming you can see my screen because it comes up as a weird view for me. Yep, great. Yeah, so thanks, Leonie. And as Leonie said, unfortunately, Toby couldn't make it tonight, so I'm presenting on his behalf. So certainly acknowledge his work in pulling together the content of this presentation, and also work by Wylie Southwell, who is the Senior Director of Public Health Risk Communications, who also assisted in pulling the content together for this evening. So I would like to acknowledge the Ngunnawal people as the traditional custodians of the land that I'm joining you from, and I'm sure a number of us are meeting from, and to also recognise any other people or families who have a connection to the lands of the ACT and surrounding areas. So yeah, hopefully this follows on really nicely from the context and the really practical tips that Kate and Jennifer have given us. I was going to zoom out just a little bit and just talk through, I guess, just an understanding of what some of the emergency management arrangements are in the ACT, because sometimes that is useful to understand who the lead and support agencies are, what's happening in planning, and when the reason it says plans and planning is that there are specific plans, capital P plans, and then there's lots of little p planning. What happens in response? Touch on some communications, both for the general community and how we plan to communicate with healthcare professionals and always welcome feedback in that space. And then just briefly touch on some of the specific hazards that we've already heard some great context on. And yeah, there's lots of information on the health website, which hopefully you will start to notice undergoing a bit of a refresh in coming months also. So under legislation, there's an ACT emergencies plan, capital P plan, and that plan designates a lead agency, so a lead area within ACT government for each type of hazard. So that lead agency then takes on maintaining the relevant plans and capability to respond, and controls and coordinates when that specific emergency type happens. So for example, for bushfires in the ACT, it's the Rural Fire Service. That's not a surprise. For heat waves, it's ACT Ambulance Service, the lead agency. For pandemic, it is ACT Health. And for water quality, it's Icon Water. So that's just some of the examples under those ACT emergencies plan. And then the supporting agencies would support the lead agency, manage any consequences of the emergency in their domain, and ACT Health have a role as a supporting agency, so for any health consequences across all hazards. So there is a preponderance of photos from COVID times in this presentation, but plans and planning. So the ACT emergencies plan, so the kind of the overarching plan is what's legislated under the Emergencies Act, and that comes under the responsibility of the Emergency Services Agency Commissioner, or the ESA Commissioner. So the hazard-specific subplans that come under that emergency plan include the bushfire plan, the storm plan, the health emergency plan, etc. And then there's subplans under that. So a subplan of the health emergency plan is the emerging infectious diseases plan, or the pandemic. So plans and planning can certainly get complicated. So I think we're all aware of this recent example. So this was an example of the Commonwealth, so the national plans, and then the ACT plans that existed for a pandemic caused by a respiratory virus in January 2020. And then by June 2020, you can see it's very small, but the key thing from this is that each of those boxes is a plan. Purple are all the ACT plans, blue are the Commonwealth plans. You can see all the complicated interactions between them all. They were all developed with a varying degree of co-design, and that's where the key challenge comes in about timeliness. You know, we endeavour to incorporate diverse stakeholder requirements and feedback, but that also means that sometimes plans can become long and complex. And in Toby's words, there's a maxim in emergency management that plans that are too long stay on the shelf. So, and sometimes the complexity of plans can be a barrier to successful planning. So, you know, the key thing, you know, certainly COVID turned that kind of previous doctrine of emergency management kind of changing slowly and in quite a planned, deliberate manner really on its head. There was a lot of rapid and continual change. And the key challenges that I think we all absolutely relate to, we're keeping up with lots of different components as they were evolving. And then also making sure that we're, you know, incorporating all the key focuses on high-risk settings, priority populations, which will vary depending on the hazard that we're talking about. So for the specific hazard, the lead agency has the control and coordination for the response, and will follow their plan through an incident management team. And that incident management team will work from an emergency operations centre. So the type of emergency operations centre, or EOC, will vary depending on the lead agency. So it might be a health emergency control centre, it might be a police operations centre, it could be an incident control centre. And for a simple emergency, public information will be managed just directly by the lead agency. But for a complex or large emergency, something called the PIC, which is the Public Information Coordinators Centre, is activated, and that's to coordinate public information across government. So yeah, all the different elements that we would consider. So from a community services perspective in an emergency, so it could be, there's a number of different things that can be activated, again, depending on the hazard. So it might be that that's community information services hubs. So that's to try and provide a one-stop shop for information and advice in affected areas or to affected populations. Heat or smoke refuges, so they could be established in government or community facilities to try and provide relief from extreme conditions. Distribution nodes, so a mechanism of distributing PPE, be that masks or other relevant considerations depending on the hazard. And then finally, relief and evacuation centres. So relief and evacuation centres in the ACT are established and operated by the Community Services Directorate. So that's one of the directorates within the ACT government. Generally, they operate out of schools or colleges. Again, it kind of comes down to the geography of the emergency and of the location of people affected. That the aim of a relief or evacuation centre is to act as a hub for information and relief services. So it may include community providers or community organisations, non-NGOs, government relief agencies, including mechanisms to identify temporary accommodation support, assistance with domestic animals, and first aid services that are provided through St John's Ambulance. And they don't necessarily have a medical capability on site, but absolutely would be directing people to services. And there's typically a relief or evacuation centre in the ACT doesn't have overnight accommodation unless it's an extreme circumstance where those other temporary accommodation support arrangements aren't in place. So what's ACT Health responsible for? So I mentioned before that we're the lead response agency for human diseases and then a support agency for all hazards. So what do we mean by support agency for all hazards? So I guess we would be managing the health effects of health messaging and health advice and health mitigation strategies for poor air quality, I think is a common example. Advice around vector-borne diseases, similar. Potential impacts, again, as we've heard from previous speakers, and I think Jennifer really did a good job about thinking about all the various implications that can happen depending on the context that you're working on but it can be disruption of hospital and health services or mechanisms for people to access them, disruption to essential services, which can include the power and other things. I mean, I think we've all experienced today a disruption to telecommunications in terms of operations of the acute health services. It could be an increased burden across the healthcare system, so including not just the hospitals, but pharmacies, general practice and other community healthcare settings. Shortages of medical and pharmaceutical supplies, damage to certain health infrastructure, and disruption to the ability to respond. So Kate touched on some of this, but this is just a summary of the Bureau of Meteorology's seasonal outlook for November 23 through to January. So what this figure shows, it's probably quite hard to see because it's small, but it's basically showing that temperatures at the higher end of the scale across most of the country. So that's the figure, the very red figure. It's red on my screen. Hopefully it's red on your screen. And that scale on the side is about the chance of exceeding the median max temperature. So you can see that it's a very high chance, so essentially 80% or more. The rainfall's at the lower end of the scale, so that's the one on the far right. And the scale there is the chance of exceeding median rainfall, and you can see that the browns are quite a low chance. And then the kind of pale colours, kind of that 45 to 55%. And then high fire danger. So particularly in the southeast, and noting that there's more detailed bushfire season outlooks, and I think Jennifer might have included a snapshot from the Australasian Fire Authorities Council. So that's just afac.com.au, and they've got a number of maps that drill down by different jurisdictions. ACT is currently not forecasted at an increased fire risk due to the soil moisture load, but clearly if things stay dry, that's subject to change. And I'm sure that you're all aware that the Bureau of Meteorology has declared an El Nino or El Nino event for Australia through until, at this stage, autumn 2024. And, you know, the things that we're seeing in this, so reduced rainfall, warmer temperatures, shifts in temperature extremes, and increased fire danger, particularly in the southeast of Australia. So what could this mean for the ACT? And I guess it's the ACT and surrounding areas, because clearly we also service a lot of people in surrounding areas of New South Wales, and also provide health services for a lot of southern New South Wales. So a number of things there that I'm sure are not surprises, and certainly build on what Kate and Jennifer have already spoken to this evening. So just wanted to quickly touch on communications. Just as we were preparing for this, I picked up out of my mailbox the latest Our Canberra magazine that I'm sure the Canberra-based people on this call, and I noticed that it had the 2-pager on preparing for the summer season. So there's quite a lot of information in that. There's some of the snapshots, the discuss, know, prepare and keep that Jennifer showed before. Talks about the emergency warning systems, and also includes some advice about beating the heat and having a home emergency kit. So, so ahead of the kind of high risk weather season, there's a lot of communications that are happening, not just from health. So, you know, certainly from a health perspective, we're planning on, you know, prioritising messages about people most at risk of severe health outcomes in the community, helping people recognise if that's them. And I think Jennifer touched on some really great practical tips for helping people recognise that that might be them, and how can they think about preparing. And also working closely with health sector partners and NGOs about how can we have a coordinated approach to government communication. So in the event of an emergency, there's lots of different channels that will be used for communication, so I won't read all of them out, but I'm sure that they're all channels that you're familiar with and have received information through. How do we communicate with priority populations? So lots of different mechanisms are used, so community radio, community advocates and representatives, different peak bodies, and established community products from community services as well. And then how do we communicate with health providers about emergencies? So hopefully you're all familiar with Chief Health Officer alerts, which are all available in the one spot. I probably should have put the link there, but they're all on the ACT Health webpage, and there's an archive of any, I think the only ones that we've actually archived is when we've updated them. So for example, an updated JEV one or an updated MPOX one, in terms of condition specific. Emails and letters, webinars, clearly we're doing that tonight. In terms of distribution lists, so we do try to utilise channels through CHN distribution lists, RACGP, other mechanisms, so for pharmacists through PSA, allied health distribution lists. But certainly, I guess just to reiterate that it's good to make sure that your current details of somebody in your practice or workplace or clinic or whatever setting you're in is up to date with CHN or other peaks, and that there's a process for how you distribute any key or relevant information within your workplace, noting that we're very conscious of the high degree of information that that we're all saturated with on a regular basis. So yeah, I guess just being clear on what are the mechanisms in your setting that you're receiving that information. If you're not receiving emails with latest alerts or notifications through newsletters, checking if someone in the practice is and what is the mechanism of distributing it, or adding yourself to mailing lists. So CHN newsletter in particular is one of the backups that we use. So I was just going to very quickly touch on some of the specific hazards of interest that neatly match what Kate and Jennifer spoke to earlier. So the first one was just to briefly talk to heat. So the lead agency for the heatwave emergency plan in the ACT is the ACT Ambulance Service, and then Health are a supporting agency. So the focus right now is preparedness. The messages that we already heard about considering your own business continuity plans for you as an individual, for your practice, and how you can be advising patients, in particular those patients that we've seen who are at in particular elevated risk of adverse outcomes from prolonged extreme heat. And I think Kate had a really nice list of them up before. So I think there was some good key points covered tonight. There's also, I noticed there's an upcoming webinar that New South Wales Health are running, but it's come out through the ACT New South Wales RACGP newsletter, and I would encourage people to consider that's later in November, focusing specifically on heat. Heat waves are defined by the Bureau of Meteorology Heatwave Service, so it's a combination of some modelling and some forecasting tools. The definition is a bit contextual, so it takes into account maximum and minimum temperatures, the normal local climate, and recent weather, and they calculate an excess heat factor that combines average 3-day temperatures with the normal expected temperature and observed temperatures over the past 30 days. I know that that definition has slightly shifted, so but I think the key thing there is whether or not you're getting a period of reprieve. So are we getting minimum temperatures that allow people to have a respite from the heat? And heat waves can be classed as low intensity, severe, or extreme. In the ACT, we would generally act on severe or extreme heat waves, but we absolutely could act on a prolonged low intensity heat wave. So there's always going to be that contextual assessment done. Bureau of Meteorology will generally provide 3 days of warning. So health and ambulance would then collaborate to escalate the messaging to the community if we were getting signals of an upcoming heat wave. If a heat wave is prolonged or extreme, there is the option to open heat wave shelters using government and non-government facilities, and that relevant information would be provided at that time. Noting that the nice thing with, not the nice thing, it's probably the wrong phrasing, the easier thing in responding to heat is that that there is value for an individual from a period of time in a cool location. And there are many kind of publicly available cooled locations. I think it's a bit trickier with smoke. Bushfires, so many in the ACT community will still be affected by the bushfires of 2003 that many of you may remember or have experienced. And I think that touches on some of the resources that Jennifer was sharing about. I was scribbling down around the skills for psychological recovery. Many people also may continue to be affected by the Victorian fires from 2009 and those that were around us in 2019 and 20. So, there is a predicted low risk of bushfires directly impacting on Canberra for the upcoming summer season, but certainly continue to be actively monitoring that situation, mindful of the impact on people's social and emotional well-being through the season. I was interested to note that little Our Canberra thing that I was just browsing just before jumping on here also has a QR code. At the moment, ACT government are actively seeking feedback on the social recovery from disaster in the ACT. That includes a focus on wellbeing and what are the strategies. So certainly can point people in that direction if they're keen to give feedback. And then the final hazard I just wanted to quickly touch on, I'm conscious that it's 8:30, is bushfire smoke. So for those who are Canberra based, so in 2019-20, certainly Canberra experienced very poor air quality associated with the bushfires around the Canberra region. And certainly that's something that we're, you know, reflecting on and preparing ahead for the possibility of future similar events. So one of the things is near real-time monitoring of air quality. So in particular, that particulate matter 2.5 that Kate mentioned earlier, that is associated with bushfire smoke. On the ACT Health website, there's a air quality health advice portal, and that has recommended actions against the different categories of air quality that go from good through to very poor. And there's a table that has specific messaging and on actions that are recommended for people at each of those categories. And that's now updated national guidance that came out following those 2019-20 experiences across Australia. So continuing to try and refine that messaging and how we present air quality data. And I think Jennifer shared, I can't remember now, or maybe it was Kate who shared that that really great infographic that a new population health exchange had developed. I think it was the 10 key things to do to minimise the impacts of smoke. So that kind of red and grey and green infographic that also a lot of work was done to make sure that it was also quite visual, so it wasn't depending on language. So prolonged poor air quality events, there are some plans that around supporting distribution of P2 masks and options around the smoke refuges. And I guess the key call to action here is, you know, similar to heat, we know that certain groups of people are disproportionately impacted by poor air quality and at higher risk of the health outcomes that Kate talked about earlier. And so again, this is where you can assist to talking to those patients and helping them prepare. So optimising respiratory and chronic disease management, as you always are, but particularly in the lead up to summer as an extra tool to starting those discussions. So I actually think that this has really been covered off very nicely already. So it's all those actions at a practice level around ensuring that your facility or your service or clinic or whatever your context is has reviewed its business continuity plan ahead of the summer, and that it considers any likely hazards that your service may face, how you would communicate with your staff, with your suppliers, with your patients, how you'd get your information. So what are your sources? Are you on the right distribution lists? Who would be making decisions? So who's kind of got the authority in your context, and how would you restore any impacted services? A reminder around communicating service availability and opening hours. And there was this little comment here that about volunteering your service as a clinician is really through St John's Ambulance or volunteering ACT at the moment in the ACT context. But, you know, absolutely, we have looked with interest at models that have been taken in other PHN areas, as Jennifer touched on earlier. That was all I had to say, Leonie, so hopefully that was under 20 minutes.
That was great, Sally. Thank you. It's very useful. It sounds like from a practical thing that primary care people could do would be to have a practice meeting where you go through how the practice will respond to a disaster and also how to kind of look after the patients. So, and there's lots of resources that we can use that we've learned about tonight. So thank you. Yeah, that was great timing. We've got time for a couple of questions, if that's okay with the panelists. And then I thought I might just give each of the panelists an opportunity to say their key message if they'd like at the very end, and then we'll wrap it up. So I'll just read out the first question, and it was, thanks, Kate, for such a powerful presentation, and I second that for sure. A clear and present danger. What are your thoughts in terms of a systemised way of engaging primary and secondary school councils and psychologists with climate emergency mental health issues? And thank you very much again. Yeah.
Yeah, no worries, Leonie. And yeah, thanks, Chris, for the question. It's not something that I'm aware that has been done, but I think it's a pretty smart idea. Certainly, you know, all children learn about climate change at school. You know, they know about it. All kids know. You know, they're all taught about it. They're all definitely experiencing the natural disasters that we're all experiencing. They're all aware of heat and fire. And, you know, like I've got nephews who are scared when it rains because they lived through the Lismore floods. So, you know, certainly the mental health impacts are impacting on our children. Whether it is something that we can systemically do, you know, educate school counsellors, school psychologists around the mental health impacts of climate change and natural disasters, I think it's a good idea. I think, you know, doctors, psychologists, all of us are on a spectrum of our understanding around climate change. You know, there are some health professionals who still are quite in the denial camp, and I think we still see that in psychology, where there's some people that are more aware than others. So, yeah, I think it's a good idea. Maybe it's something that we should, you know, roll out, try and organise.
Thanks. So the next question, and I might try and answer it, is how do we advocate for health pathways to be tailored for other states? And I think you'd probably just approach your PHN, and you could use the examples of the ACT Health Pathways disaster management's been localised, or the Blue Mountains ones have also been localised, and I think the Nepean health pathways have also been localised for the disaster management. So I think you'd probably approach your own PHN and provide those examples of how they can be localised. We have another question, and I think this one might be for you, Sally. Evacuation and relief centres and cool places to shelter, what COVID protection are being built into them?
Yeah, good question, Leonie. So certainly we have had many discussions with Community Services Directorate, who are the lead for this. In the past, there's been some site visits and thinking about exactly how we would handle that. So anyone who had symptoms or was you know, aware that they had been in contact. So it has been factored into the plans that are being used. I guess not just about COVID, but I think we're also all much more aware around infectious diseases generally. The community are much better at being aware, monitoring for symptoms, and it has been incorporated, is my understanding, into kind of the flow. Yeah.
Thanks, Sally. I have a question for Jennifer. So when you've lived through the bushfire situation, supply chains for medications and things, pharmacy supplies, have they been a challenge for your patients?
Oh, absolutely.
Yeah.
And that's why, you know, one of the things that I've been quite keen to encourage my more vulnerable patients to make sure that they're well stocked, you know, so don't leave things to the last minute that, you know, they've only got 2 tablets left, so they're getting repeat. You know, coming into summer, I usually encourage that as soon as they get something dispensed, you know, within a couple of weeks, they're getting their next box ready, right, and it's sitting there ready to go, because our town is a very small pharmacy, and the pharmacist doesn't live locally, and so they wouldn't necessarily be open. So even though nominally there's a pharmacy in town, they aren't necessarily going to be functioning. So people are going to have to be very self-reliant. And that's where the planning comes in, because, you know, it's not like if you're living in the suburbs in a larger town or in a city, then, you know, you can ring around and find somewhere that might have your script, but you don't have that luxury when you're, you know, on the urban fringe or in a more rural area. So people have to take a little bit more responsibility for their self-care.
Yeah. I think even in larger cities or in Canberra, elderly people might be wedded into one pharmacy and not know what to do if their pharmacy goes offline.
And that's where I just on that, you know, it's actually quite important to have that conversation with the vulnerable elderly to say, well, you know, would you be happy for me to have a phone consult with your, you know, son or daughter, or would they be available to come in, just so they're an integral part of the plan, if that's, you know, and if it's not a family member, it might be a goodly neighbour, or just someone who can advocate for that elderly person if they're not up to being able to source their own scripts.
Yep. Thanks, Jenna. So we'll probably wrap it up now, but not putting you on the spot, but if you'd like to, if you've got a last message for attendees, Jennifer, you can go first.
Okay, well, as I said in the slides, I think, you know, self-care is really important. So you're not going to be any use to anybody if you're freaking out and you can't breathe, if you're an asthmatic like I am. So, you know, making sure that you and yours are all okay and you've got a plan, and then you can roll out and work for the practice and for your patients as well. But if you're non-functioning, then you're not going to be able to help anybody else.
Thanks. Okay, Sally, would you like to go next?
Sure, sorry, had to find my little unmute button. And sorry, I meant to add before to that question about shelters, I typed it in, but to be clear that people will not be turned away if they have COVID, like seeking emergency shelter is a priority and there are processes at the shelters to deal with it. Yeah, so I know that was a bit of, you know, in flooding and fires in past seasons, that's been something that people have been quite worried about. Yeah, so key message, yeah, look, I think that was a really nice summary about, you know, preparing yourself, but preparing your practice and thinking about the preparedness discussions with your patients, depending on the patient demographic that you have, but just incorporating those discussions about being prepared and helping people recognise that they are potentially at higher risk. I certainly know that my own family are not very good at recognising, particularly the older members of my family are not very good at recognising that they're at, particularly for heat, and you know, particularly when they're in habits of wanting to do things at certain times. You know, I always do this thing at this time on this day. Well, maybe don't do it today when it's hotter. That kind of, you know, opportunities to have those discussions with patients, I think, is really important.
Thanks. And Kate?
Yeah, sure. First, just thanks, Leonie and the CHM for putting this on, because I think, you know, having something around disaster planning for us as health professionals is a really important thing for us to be doing, because obviously my message is that, you know, our planet's getting hotter and, you know, we are going to encounter these things increasingly as doctors, and it is part of climate change adaptation to be disaster ready. And of course, as I said 3 times in my slides, we can also advocate for climate action to stop making the problem worse. But yeah, I say that every day, maybe 50 or 5 times or so. But yeah, thanks. That's me.
That's great, thanks. And I just also like to direct people, if you're feeling overwhelmed, a good place to start is the Health Pathways disaster planning heatwave related illnesses pages, and then you can work out from them. And we'll also be sending out all the resources to you after the event. And the recording will go up on the Capital Health Network YouTube page. So please fill in the evaluation surveys and we'll send you out your certificate of attendance, and you can claim the CPD and enroll in the RACGP one later in November. I think, and I think that's it now. Thank you all very, very much. Thanks and good night.
Good night, everybody.